Welcome to Michigan Medicine. We are pleased you have chosen us for your care. My name is Dr. Eric Wamstaker, and I am an associate professor and a gastroenterologist in the medical procedures unit. The purpose of this video is to provide information about the procedure that you will have today. We will also cover the benefits, potential risks, and alternatives to the procedure. You can ask your provider any additional questions you may have. The procedure you will have today is called endoscopic mucosal resection. This is a specialized type of endoscopy that a trained gastroenterologist performs to remove abnormal, precancerous, and early cancerous growths or lesions from the gastrointestinal tract or GI tract. The GI tract includes the esophagus, stomach, small intestine, large intestine, and rectum. Now let's talk about how the procedure is performed. Depending on the location of concern, the gastroenterologist performs this procedure using a long tube containing a light, video camera, and instrument channel. This tube is referred to as a scope. When the area of concern involves the esophagus, stomach, or small intestine, the scope is inserted down the throat to the area of concern in a procedure referred to as an upper endoscopy or EGD. When the area of concern involves the large intestine, a similar scope is inserted through the anus into the colon in a procedure called colonoscopy. After the scope is inserted, the endoscopic mucosal resection can be done. The gastroenterologist removes the concerning lesion by injecting a fluid cushion into the wall of the GI tract, lifting the lesion away from the deeper layers of the lining of the GI tract. This allows for removing the lesion without injuring the deeper layers. Once the lesion is lifted away, a special instrument with a metal loop known as a snare is advanced through the scope and placed around the lesion. The snare is then closed completely to remove the lesion. During the same procedure, this process is often performed repetitively in a side-by-side manner in order to remove larger lesions such as a large colon polyp or early esophageal cancer. Now I'd like to discuss the benefits and risks of this procedure with you. I will start with the benefits. This technique allows the gastroenterologist to remove abnormal tissue, precancerous tissue, or even early cancers from the gastrointestinal tract without surgery or incisions through the skin. In most cases, this is performed without admission to the hospital, and people generally recover quickly and resume a normal diet either the same day or within a few days. For many people, this technique will help them avoid surgery. It is important that you also know and understand the risks of the procedure. Endoscopic mucosal resection is considered a safe procedure. The risks are low, but may include a reaction to the sedating medication, including breathing or heart problems, bleeding, which can occur in less than 3 to 5 out of 100 people, perforation, meaning a tear or hole in the bowel, which can occur in less than 1 in 100 people, infection, which occurs in less than 1 out of 100 people, aspiration, where the contents of the stomach get into the lungs, which may lead to a lung infection called pneumonia. This occurs in less than 1 in 100 people. And lastly, when endoscopic mucosal resection is being performed in the esophagus, there is a risk that your esophagus may narrow during the healing phase after the initial procedure. This could make it difficult for you to swallow. This occurs in 3 to 8% of people. It sometimes requires another procedure called esophageal dilation to relieve the narrowing. Blood transfusion or surgery may be needed to treat the conditions above, but this is rare. Your risks are higher if you are taking steroids or blood thinners, or if you have certain serious diseases such as heart failure or severe lung disease. Now let's talk about alternatives to endoscopic mucosal resection. In most cases, surgery, which carries more risk, would be considered the only alternative to endoscopic mucosal resection. Thank you for reviewing and understanding the risks and benefits of an endoscopic mucosal resection. Your doctor can answer any additional questions you may have. Thank you for receiving your care at Michigan Medicine.